My name is Ashley McMullen. I am the former ambulatory chief resident for UCSF Internal Medicine based at the county hospital. But starting in the fall, I'll be taking a position with the VA hospital. I'll be an assistant professor of medicine in the Division of General Internal Medicine. Part of my focus will be on increasing diversity initiatives within primary care. So I think that medical humanities has gained a lot of traction in the last couple of years, particularly in undergraduate medical education. And I'm interested to see how I can figure out ways to embed that more in day-to-day practice, especially in primary care. I think as physicians, if we're able to create the space and time to really learn a patient's story and develop the narrative skills to be able to articulate that in a way that both we and others can understand, it helps us establish a better connection and also combat a lot of the burnout that we're seeing in outpatient care. For me, being a Watson Scholar is just such an incredible honor. I spent the last 4 years here of residency and chief years seeing what it means to be a leader in academic medicine. And now with the Watson, early on in my career, it gives me the leverage to carve a path of my own choosing and be a leader in the ways that are meaningful to me. I think having the Watson is just so validating to actually be seen and feel like UCSF is very much invested in my success and also the success of a number of faculty from diverse backgrounds. My hope for the Watson is that we can show that diversity, equity, and inclusion are more than just talking points in a presentation. These are actual core values that we uphold at UCSF, and we can show that when you invest actual time, energy, and funds into these principles, we can create a better work environment for everyone. Being a chief resident at the county hospital and spending a lot of my time in residency there, I got to know and work with a lot of vulnerable populations in our safety net system. The VA will be a little bit different, but I'm excited for that as well. A lot of our vets have their own vulnerable needs that we can approach, and one of the parts of my role will be doing telemedicine. This is a rapidly expanding technology in our system, which allows us to reach patients out in rural areas of California who might not otherwise be able to come to appointments. I'm also going to be serving some of my time at the downtown VA clinic, which also has some homeless vets and veterans with other social, medical, complex needs that we can address there. You know, as a woman of color and as someone who identifies as a member of the LGBTQI community, I think for me it's very important to both contribute to and work in an environment where I feel like I can be my truest self, and that extends to all my colleagues and patients as well, is that this is a place where you can succeed no matter who you are or where you come from.